Today is Blue Monday, a day considered the most depressing of the year. The theory is we're all cold, broke, and feeling guilty that our resolutions have fallen by the wayside. And of course, we're also dealing with a pandemic and the COVID-19 restrictions. There has been a mental toll, even for those who may not have felt these struggles before. I'm joined now by Phyllis O'Connor. She's the executive director in our province for the Canadian Mental Health Association. Phyllis, are more people reaching out for help as we get deeper into this pandemic?
Yeah, we're definitely seeing more people reaching out for help. People are struggling with a lot of anxiety and some depression from the social isolation. So definitely there's an upswing, yes.
Now, you mentioned anxiety and depression. What are some of the most common things that people are finding difficult or struggling with?
I think a lot of it, is the social isolation piece. Humans are hardwired to be socially connected, and that's one of the things that COVID has really taken away from us. But also, there's that kind of uncertainty. Again, people don't do well with uncertainty, and it brings on the anxiety reaction. So we're seeing a lot of that type of thing too. Just anxiety about their own health, about their family and friends, about their jobs, about their finances. There's a lot on people's plates now.
And would you say that this is significantly more than a regular year?
Oh, yeah, definitely more. People are tired. We've been doing this now for almost a year. The mental gas tank is running empty for a lot of folks, and it's really bringing on the depression and it's bringing on the anxiety. So it's important people recognize if they're feeling that way, it's normal, and feel free to reach out. We all need a little support sometimes.
I know we've been talking more and more about mental health over the last few years, but asking for help can be difficult. Where do you suggest people start?
Yeah, it can be tough. I mean, the hardest thing is admitting yourself that you need some help, because good old stigma's out there. But there's a couple of things that are really easily accessible to give some support. And one is the wellness response line that was set up by the Canadian Mental Health Association Saskatchewan division. And we have phone numbers across the province. You can find them on our website, sk.cmha.ca. And that's not a crisis line, but it's for people that maybe just need somebody to talk to, or maybe a little bit of help navigating how to find the services they need. And then we also have another exciting program that was just launched in November, very timely. It's the Bounce Back program. And that's actually for folks with mild to moderate anxiety and depression. It's done online, so you just go in there, you can self-refer, and then you're paired up with a mentor or a coach who works with you as you work through modules to help build resiliency, to give you some of those tools for the coping strategies, how to maybe refocus your negative thoughts. So it's based on cognitive behavior therapy, and it's seeing a lot of really good success. So there's another really easy, free of charge way to get a little bit of help with this anxiety and depression we're all starting to feel.
Phyllis, before I let you go, you did mention it's free of charge. A lot of counseling can be expensive for people. Are these all free of charge services if they reach out to the Health Association?
Yep, Bounce Back is free of charge, and so is the Wellness Response Line. So those are two. And then if you do need more intensive supports, then we can certainly refer people into other services that are available. But those are a good kind of first door to get into there and get some assistance.
Phyllis, thanks so much for your time today.
Oh, you're very welcome.
Phyllis O'Connor is the executive director for Saskatchewan's division of the Canadian Mental Health Association.